continuing now, my second video, it's the lower limb. The lower limb for you have to study. If you're not, don't see this video, first just go back to my previous video, that is my part 1. Then you can understand this video. Here I'm going to teach you the important questions which you may expect from the lower limb. Starting with the bones. As usual, bones are very important for physiotherapy students. Anyone, upper end of femur, upper end of tibia, lower end of tibia, fibula. Name the tarsals. This question, this carries the bones of the lower limb chapter. Chapter number 2 carries either 5 or 2 marks. That's it. Nothing much in this. Just jump directly to the practice number 3. The front of thigh. Go here for femoral triangle. Most important 5-mark question. And this is a femoral triangle. Femoral artery is for 10 marks. Vein is for 5 marks. And nerve again for 10 marks. And then one of the most important packet of the muscles question. Describe in detail the anatomy of the quadriceps femoris. This question will come in this chapter. It's for 10 marks. Quadriceps femoris. If they don't ask, of course they will go and ask you what is the vastus lateralis, or vastus group, or the rectus femoris for 5 marks. Adductor canal for 5 marks. Favorite question. If they don't ask femoral, go for this femoral triangle. They go for this Hunter's canal. Next chapter is medial side. Nothing much medial side. You can have your obturator nerve for 5 marks. Some muscles of the adductor magnus or longus make asked as the muscles of the adductor compartment under the 5 or 2 marks. And these are the questions in this region. Of course, irritating questions may come here, and they may ask you about the sartorius. Sartorius is a very important, I don't know to include it in this, but sartorius is a very important question for 5 marks. It's a very important question. The gluteal region itself is a 10 marks question. The gluteus muscles are together 10 marks or 5 marks. And here you need to just concentrate on the nerves which are supplying to it and the structures which are under the cover of the gluteus maximus, perhaps the muscles here. Popliteal fossa. Close your eyes. It's a 10-mark question, nothing else. And of course, the very important thing for this one is the popliteal fossa. If they don't ask popliteal fossa, get ready. A question like contents of popliteal fossa for 5 marks, and also tibial nerve, common peroneal nerve, both are 5 marks. If their father is not asked, the father, obviously the sciatic nerve is waiting for us. It's a 10-mark question. The sciatic nerve is the most important question in the lower limb. Please remember something. Experience of 14 years, I've seen more than 22 times asked, if I calculate the both supplementary as well as this main exam. This sciatic nerve has been back-to-back asked. There's lots of problem for physiotherapy students in applied aspects. So, popliteal fossa for 10 marks or 5. Back of thigh, nothing. I'm just going to hamstring group of muscles for 5 marks, and the king is waiting for us, the sciatic nerve. Much has been told about it. Next, on the leg part of it, the leg part of it here, the muscles of the anterior compartment of the foot, especially your soleus muscle, sorry, not the soleus, pardon me, but the muscles of the anterior compartment, which best may come for 2 or 5 marks, all the fibularis muscles group here. And then we have the tibial artery, deep peroneal nerve. These are all irritating 2 marks questions, but the superficial peroneal is a 5 mark, very important question in this region. And also in the back, just read this flexor retinaculum. You concentrated on the hand, right? So the same thing here for 5 marks. Go here for the gastronymics for 5 marks. The soleus, the lateral and the medial head of gastronymics and soleus may together come as the triceps surae. This particular part, read for 5 marks. And then the sole of the foot itself is at 10 marks. I cannot ask you to read for anything less than that. It's got the first, the second, and the third layer. If they don't ask for 10 marks, remember, they may ask you this plantar aponeurosis for 5 marks, or any of these muscles of the third layer, muscles of the fourth layer for 5 marks. Next will be the joints chapter, the most important. I'm not just going into this chapter number 11, not much in 2 marks questions may come in that. You have a lot to study. Remember, you have got first volume, second volume, and third volume. So just concentrate on the questions what I'm giving. Read this first, then you can read everything. So no blames here. You can read whatever you want, but first read the questions which I'm telling. So you're concentrated on the shoulder and the elbow and the wrist. Here 10 marks is hip joint. Very important. Knee joint is a super favorite biomechanics as well as anatomy question for 10 marks. Lot of notes in this, I understand. If they don't ask hip joint, they may ask you muscles of hip joint for 5 marks. They can ask you the movements of hip joint for 5 marks. Here the ligaments of knee joint for 5 marks. The meniscus of knee joint for 5 marks. The most of the questions from here in this. Ankle joint is a single 10 marks. Tibiofibular 5 marks. And joints of the foot 2 are irritating. Some idiot may ask for 5 mark question. question. For you to concentrate will be this chapter. Joints, do not leave anything in this. If you are reading lower volume, first time, read this starting chapter first. Then go for others. And next, because you are physiotherapist, arches of foot, 10 marks. That is a medial, especially main thing, and concentrate on that. So, finishing with this important bucket where you have to concentrate 60%. First, the 40% will be the abdominal part. Abdominal part, you concentrate on the most important, the vertebrae here. The sacrum may come for 5 marks, osteology part, and they go in directly for studying about the oblique muscles. You know, the anterior abdominal wall. The question may come, anterior abdominal wall muscles. So all this transversus abdominalis, rectus, external, internal oblique, all you need to adjust and write for 5 marks. I don't think so 10 marks ever comes from this chapter. They have enough good muscles in the lower limb to ask for 10 marks. Next, continuing, inguinal ligament, very important, 5 marks question. Rectus sheath, femoral sheath they asked, so they expect this also, a very important part. Inguinal canal for 5 marks, very important. Male genital organs, concentrate only on testis, the primary sex organ. Or if they don't ask testis, go for scrotum for 2 marks, or the epididymis for 2 marks. That's all about males. Males are worthless. Then go for the abdominal cavity. The peritoneum is not in the portions, but it's up to you to read about this. The omentums may come for 5 marks here, and also you can observe for these questions such as the lesser sac and the greater sac. In that questions for 5 marks. Stomach is a classical 10 marks question. If they don't ask, get ready for the bed of stomach for 5 marks. The relations I'm talking. Then continue with the intestines. They can ask you the duodenum. Don't read jejunum, don't read ileum. Yes, I am telling this. Don't read the question. Only there will be differences between jejunum and ileum. Just concentrate duodenum, very important for 5 marks. And Meckel's diverticulum, 2 marks or 5 marks, very important. Cecum may come for 5. And appendix may come for 5, even though they are not exactly given for the portions for you. The celiac trunk for 5 marks may come for it. The blood supply of the intestines for 5 marks. The superior or the inferior mesenteric artery for 5 marks. Here, portal vein, very important, very important for 5 marks. Gallbladder, get ready for 5 marks. Nothing much other than that except the gallbladder. Spleen, very important 5 mark question. Pancreas, 5 mark question. Liver demands respect, only for 10. This question may come for 10, but remember, pancreas and spleen, some idiots may ask for 10 marks. Kidneys, 10 marks. Classic question to kidney, 10 marks. If they don't ask you, cut section of kidney for 5 marks. Nephron for 5 marks. They may ask here. Ureters and bladder may come for 5 marks, respectively. And adrenal glands, the suprarenal glands together for 5 marks. Diaphragm and the structures passing through diaphragm is the openings in diaphragm for 5 marks. Posterior abdominal wall, just go for the abdominal aorta in this chapter for 5 marks. And sister, already I've told you in the thorax region. Again, I'm telling you in this region, these questions may come in here also. The perineum, I will just go only for the pudendal part. The uterus in this region, a very important question, uterus. The ischiorectal fossa for 5 marks. And go in for the bladder. We just told you bladder is for 5 marks. And they may ask you the wall of pelvis. The wall of pelvis muscles for 5 marks. Next will be, I'm sorry, it's very big, I understand. They ask uterus, ovaries for 5 marks. If they don't ask uterus as such, or the supports of uterus for 5 marks, very important. And ignore vagina. Yeah, you can ignore which vagina. Male, enough of the male prostate gland, 5 marks here. Rectum, anal canal, if you just want to concentrate, you can just read about it. I know it's a very long video, please forgive me. I cannot jump simply for the sake of it. And joints of pelvis may be important questions. The internal iliac artery, lymph node, these are all the questions of this region. Very tough, I understand. Do read. If you follow my video very slowly, a little bit fast I went because students pressure me to not include many things, but this have to be included. This is my second part of the total 3. The third part is coming up, which includes head and neck and neuroanatomy. Bye-bye.